Sepsis can be incredibly difficult for even the most experienced, the most highly trained health professional to spot. If you think about someone with a heart attack or a stroke, usually they're well one moment and they're displaying classical symptoms the next moment. There's a sentinel moment from which the patient knows and their family know that something's badly wrong, and health professionals can also identify the time point. With sepsis, things are different. Some people deteriorate very rapidly within a small number of hours, and the reality is they're not usually the people we miss. It's the people who deteriorate slightly more slowly, particularly if they're young and relatively healthy, because then their vital signs don't change until later on in the disease process. Now, because, quite understandably and rightly, the NHS is very focused on identifying deterioration through the National Early Warning Score, or News 2 score, we can sometimes miss these patients because their News 2 might not trigger until later in their disease process. So we also need to recognise that News 2 is not a standalone, that we need to exercise clinical judgment, that when we're concerned about one vital signs measurement, we take it seriously, we investigate further. If there are other signs that the patient might be unwell, an example being a raised lactate measurement, we need to again take that very seriously, even if the vital signs are very normal, even if the News 2 score is not triggering. So anything that's triggering our clinical sense that something might not be right, we need to listen to, as well as listening to the patient and those who care for them.